Good afternoon. Today I want to talk to you about the South African strain of coronavirus, which has been in the news so much over the last few days. I do though want to start by saying a few words about vaccination. Our vaccination programme continues to go from strength to strength, thanks to the incredible work of thousands of people around Wales, including NHS staff, GPs, military personnel, local authority staff and volunteers. The very latest figures, which were published minutes ago, show that more than 462,000 people in Wales have had their first dose of the vaccine. This slide clearly shows the speed at which we're vaccinating people in Wales. In the last week, we vaccinated more people as a percentage of our population than any of the other UK nations. But this isn't a race between the countries of the UK. This is a race against the virus, and it is one where we are making rapid progress. We remain on course to offer vaccination to everyone in the first 4 priority groups by the middle of February. We will continue to build on this progress this week as more clinics open, and we will have the support from 90 more military personnel in the mass vaccination clinics around Wales. We'll also see more people receiving their second doses of the vaccine, with mobile teams returning to care homes to complete the vaccination process. I want to turn now to the South African variant that we've heard a lot about in these last few days in particular. Last week, our Chief Scientific Advisor for Health, Dr. Rob Orford, explained how and why viruses mutate. He also set out some of the work that we're involved in here in Wales. The South African variant is one of 3 new variant strains of concern that have emerged in recent months. The other 2 originated in Brazil. We're tracking them closely because they're even more contagious and fast-moving than the original strain of coronavirus, which we have been dealing with through most of the pandemic. As you know, the Travel Corridor Scheme has recently been suspended across the United Kingdom, which means that all arrivals to the UK are now required to quarantine for 10 days. Enhanced quarantine and testing arrangements have also been introduced for people returning to the UK from certain countries linked with the South African and the 2 Brazilian variants. In Wales, we have argued for these requirements to apply to people returning from all international destinations and for an approach to quarantine and border control that also involves the Republic of Ireland. To help us find and contain cases of the South African and the 2 Brazilian variants, everyone returning to the UK from certain countries around the world where these variants are known to be present must quarantine together with their household. This requirement for household contacts to quarantine is an additional precaution to prevent any possible spread. All travellers are offered a test to check for the variant. If the tests are positive, the person's household contacts will also be tested. All positive tests are then sent for genomic sequencing. In addition to this quarantine and testing system, we also have a well-established surveillance system in place in Wales. This genomically sequences a proportion of all tests undertaken in Wales. More than 25,000 sequences were generated by the end of last year. That's one of the highest rates in the world. The majority of these come from samples taken from tests carried out in hospitals and community testing units. We're working with the UK government to expand our surveillance systems and to access more samples from tests processed at the Lighthouse Lab in Newport. As a result of all of this work, 13 cases of the South African variant have been identified in Wales to date. That is an increase of 3 from last week. 10 of these cases have clear links to either South Africa or to international travel. In the other 3 cases, there is currently no clear evidence of how they may have caught the virus. 2 of these cases are in North Wales, in Anglesey and in Conway. They have the same genetic sequence and they were tested on the same day in the same laboratory. The 3rd case is in Neath Port Talbot. Public Health Wales is carrying out a detailed and forensic investigation into each of these cases to discover when and how each person became infected with the South African variant strain and whether there is any evidence of wider community spread. In each case, we'll draw on the skills of our successful contact tracing teams to look back at where each case has been and who they've been in close contact with. We will also make use of the skills of Public Health Wales epidemiologists, and we'll also target testing to identify any further spread. We're working around the clock to discover how these 3 people became infected with the South African variant, and we will do everything we can to keep people safe. The emergence of all of these new strains. First, the Kent strain, which has quickly become the dominant form of coronavirus here in Wales, and now the South African and the 2 Brazilian variants, mean it's more important than ever that we all follow the rules, especially the basics. That means keeping our distance from others, washing our hands regularly, wearing a face covering when we're in indoor public spaces, ensuring good ventilation indoors, staying at home as soon as we have symptoms and arranging to get a test, and please ensure that you do complete your full isolation period. Thank you for all of you for your ongoing help and support to help keep Wales safe. Your hard work and sacrifices are already making a real difference. I'll take questions from journalists now, but as always, the answer will be broadcast live on our social media channels. And the first question today is from Nikki Smith from BBC Wales.
Good afternoon, thank you. I'd like to ask about the South African variant. You've listed 3 specific areas where it has been identified. Do you intend to offer door-to-door testing there now, as is happening in parts of England?
We're not going, at this point, going to look to an approach that has whole community testing across a whole local authority area. What I indicated was we're looking at targeted testing. That's why the backward contact tracing is really important to understand who those people may have been in contact with. We have further meetings later in the day with Public Health Wales and the Chief Medical Officer's department as well to understand more about that, to then make choices about what form of targeted testing that might look like. But I'll obviously have more to say, or the First Minister will have more to say when those meetings have concluded.
Thank you. The week after next, you will be hoping to hit your vaccination target. Will this mean you can then start easing restrictions?
I don't think we should expect a significant reduction in restrictions from mid-February onwards. What I should say is that we have a regular review process. We'll be due to complete a review by the 3rd week of February, so we'll be able to update people then. The good news is we're broadly moving in the right direction on a range of indicators. On the number of people testing positive, we're now down to under 125 per 100,000. Before Christmas, we're up to nearly 700 across Wales. That's a significant fall. Scotland is about 140 per 100,000 today. England is about double that. So we're moving in the right direction. We're also, because we're making rapid progress with our vaccination programme, we can look forward to different choices being made. But I still don't think people should expect there to be a radical and significant easing of restrictions when we come to review matters in the 3rd week of February. But we will, of course, have to look at what's happening with those continued reductions, seeing those being sustained, and then to see what headroom we have, together with all the other choices, given that it is a stated commitment of this government to, if we can, to use our headroom to help a return to school. We'll then need to assess the impact of any return to school that does take place. Thank you. I've now got James Crichton-Smith from ITV Wales.
Minister, thank you. The British Medical Association has carried out a survey which shows that compared to their white colleagues, a higher percentage, nearly 3/4 of doctors from BAME backgrounds feel just partly or not at all protected from COVID in the workplace. What are you doing to change that?
Well, I haven't seen the survey you refer to, but we have regular engagement, not just with the BMA, but across all the workforce. And in particular, I'm really pleased with the engagement we've had with BAPIO, the British Association of Physicians of Indian Origin here in Wales. In fact, the chair of BAPIO, Professor Keshav Singhal, he's actually been part of the risk assessment process we've introduced. You'll recall that as part of the work we did, there's been a specific risk assessment process for staff of Black or Asian origin to undertake and to look at specific factors for them. Obviously, if doctors and other staff still feel concerned that that risk assessment process hasn't resulted in giving them the confidence they need, that's a matter that not just those individuals should have conversations about, but actually the regular conversations that trade unions and staff side representatives have with managers and employers here in Wales. So I'll make sure that after this that I ensure that not only are those conversations taking place, but we do take account of what more we need to do to provide confidence for our staff in all of the different measures we're looking to seek to protect them as they put themselves in harm's way every day for our sake.
Thank you very much. Secondly, can you absolutely guarantee that no health board in Wales is throwing vaccine away rather than finding people to make use of leftover doses because they're under strict orders not to skip ahead in priority groups?
I think there's a couple of assumptions there in your question, James, that'd be helpful to deal with. So we publish every week now wastage rates, and we have extraordinarily efficient process for our vaccination programme. 0.1% of the Oxford AstraZeneca vaccine is wasted, 0.6% of the Pfizer vaccine is wasted. So that's highly efficient and effective use of the vaccine. I expect, particularly as we're running through groups 1 to 4, that there are plenty of people who should be on reserve lists. Every health board and every delivery of a clinic delivering the vaccine should have people on a reserve list to make sure we don't waste vaccines. It's also worth reflecting, of course, that there's a number of days to use the vaccines up once they've been provided. So that's where we are with our understanding of it. And actually, as we're going through priority groups 1 to 4 now, but moving into groups 5 to 9, there should be plenty of people on those reserve lists. I don't expect vaccines to be thrown away. Organisations are not under an instruction to dispose of vaccines instead of actually providing that vaccine to people who could benefit from it. So there are further conversations ongoing with Vaccine Programme Board about how we have those reserve lists to make sure we carry on with our highly efficient programme here in Wales. Great work on the numbers and progress being made, and also really, really effective on not wasting the precious vaccines that are available to us. Thank you, James. And I've got Abby Whittick from Wales Online.
Good afternoon, Minister. You mentioned the South African variant, but now there are concerns about mutations that are circulating now in both Bristol and Liverpool. Given the proximity of those cities to Wales and the fact people travel a lot between the two for work and for other reasons, what monitoring and testing is taking place to see if those variants are happening now in Wales?
Well, Abby, we have a regular conversation with colleagues at ministerial level across all 4 nations, between our chief medical officers and our scientific community as well. There's also an exchange of information between our public health agencies, and they're organised in different ways in England compared to Wales. But it's always a case of understanding that that the virus is changing and mutating, as Rob Orford explained last week, and it's the variants of concern we're most interested in. So I do expect information to continue to be shared to understand what is really happening. And whilst people may travel for essential purposes, those are limited purposes. There should be very limited travel between Bristol and South Wales in particular, for example. And more than that, of course, if people are travelling for essential purposes, they should still then be coming back to their household as well. So the opportunities for wider community spread at this point in time should be limited. But that sharing of information between all agencies is essential to keep all of us safe.
Thank you. If I could just move onto younger people now. Is the negative effect of lockdown on children and young people being assessed when the Welsh Government makes decisions on restrictions policy? And if so, who is assessing those effects? And how is that being weighed up against the need to protect lives and the NHS?
Well, this is a difficult balance, but we definitively and absolutely do go through an assessment process of the impact on different groups of the population. You'll understand that most of the mortality has been in older age groups and other people with additional risk factors, but that actually we know there's lots of harm that lockdown causes for children and younger people in particular as well. We had the report earlier this week that missing out on face-to-face learning it will potentially have an impact on future life earning opportunities for our youngest people who are missing out on face-to-face learning in school and college. So we publish, of course, when we have our 3-week reviews, we publish our assessment on the impact of different people, including children and young people. And because we recognise that impact, it's part of the reason why we said that our commitment is, if there is enough headroom, to use that on reopening parts of face-to-face learning for children and young people. So there's a definitive commitment to do something that recognises the impact on children and young people. And the balance of the harms is something that the Chief Medical Officer spoke about at the very start of the pandemic, nearly a year ago, and is absolutely part of what we turn our minds to every time we make choices about either new restrictions coming into force or indeed the easing of those restrictions as well. Thank you, Abby. It's now Dan Bevan from LBC.
Thank you, Health Minister. Good afternoon to you. You say there are 3 cases of the new South African variant with no clear evidence of how they may have caught the virus. If that's not come from international travel, then is it safe to assume the South African variant has spread in the community? And if that's not the case, then what could the other possibilities be?
Well, the reason why we're doing that backwards contact tracing around those 3 people is to answer exactly that question. Now, the fact we've only got a handful of cases at present suggests that there isn't sustained community transmission in Wales of the South African variant, but we need to understand what's happened with those 3 cases to understand how those people have got the South African variant, if they have come into contact with other people through different points of contact earlier on. So that's why the investigation is taking place, because we need to answer that question. The contrast, of course, is that the Kent variant has got into sustained community transmission. It's now the dominant form of coronavirus in Wales. We know that in itself is much more contagious as well. So it's about understanding the impact of this new variant and where and how those 3 people may have come into contact to acquire this particular strain of coronavirus. And as we have more information about that, we'll of course make sure that's shared with people.
Thank you. And of course, the Six Nations starts this weekend, but of course it'll be very different because of crowds not being allowed. I know you're a rugby fan yourself. Do you hope that crowds in some form, even if it's a reduced capacity, might be able to make it into the stadiums for the autumn internationals?
Well, autumn's a long way ahead, Dan, and I would love it if we were in a position to have crowds available in the stadiums in the autumn internationals. But the horizons we're dealing with are such that I don't think I could accurately forecast what will happen in the autumn. I certainly hope, given the progress we're making now with reducing case rates, with the reducing positivity rate and the progress we're making on vaccination, we'll be able to make many different choices. But we also know the virus has thrived in the autumn and the winter as well. So we need to understand where we get to after the mass vaccination programme for the whole adult population has been completed, what those choices mean. And I really do hope that we'll be able to make different choices for all of us, not just for rugby fans, but for all the other activities that we've had to curtail to keep the country safe throughout the pandemic. Thank you, Dan. Now got Branwen Jones from S4C.
Prynhawn da, Gweinidog. Swansea Bay University Health Board recently announced that they were experiencing a sharp rise in the number of people failing to turn up to their vaccine appointment. Is the Welsh Government aware of this, and what are they doing to aid health boards in addressing the situation?
Well, we are aware. We've seen some of the public statements that the Health Board have made, encouraging people to attend or to let them know if they can't attend. And it goes back into some earlier questions about having reserve lists to make sure that the vaccine isn't wasted. And I think the direct message is that there's a very clear and central message from the government, and it's well covered across a range of media organisations and social media too, about the importance of the vaccination programme, the importance of covering as many people as quickly as possible. The government, of course, we need to play our part, as indeed will our NHS, and it's then about how each of us as members of the public play our part too. And if we can't attend, then to let the vaccination team know as soon as possible. With the vaccination contact, offering people an appointment, there is a way to contact to make clear if you can't attend. So the worst thing possible would be a vaccine waste because people haven't attended and our vaccination teams don't know about that until too late. I think our vaccination teams are doing an extraordinary job of incredible service to the whole country with the pace and the scale of what we're delivering. So all of us need to play our part because we'll all benefit from this programme rolling out as quickly as possible.
Diolch, Gweinidog. The UK Health Secretary, Matt Hancock, has said that he is optimistic about the prospect of people being able to enjoy a holiday in the summer. Would you agree with this sentiment? And has the Welsh Government considered any plans on how to keep control of the virus in later months?
I'm optimistic that people will be able to have a holiday break of some kind over the summer. I wouldn't want to forecast where that would be, though. We know many people are opting to stay within Wales or the UK. But the challenge is that we know that from this summer, international travel to mainland Europe caused lots of mixing and a reintroduction of coronavirus into the UK, and it helped to promote the growth of the virus through the autumn. So we're all still going to need to make responsible choices. If international travel restarts in earnest for people to be able to go on holiday, we'll then need to see what the rules are about either vaccination or about testing before an arrival back as well. So I don't think we're going to go back to the days we would have enjoyed, say, a year and a half ago. So I don't want to get too fixed on foreign travel for holidays at any point in the future, because I just think that's too uncertain. What we do know is that we're winning the battle at this point in time in reducing case rates, in increasing vaccination, and that will open up more choices for us in the future. If we all keep on doing the right thing, we'll be doing the best thing for ourselves, but also for all of us in this country and beyond. Thank you, Bradman. And I've got Steve Bagnall from the Daily Post.
Thank you, Health Minister. It may be too early to tell, but compared to the Kent variant, is there currently any evidence the South African variant is more infectious or causes more serious illness?
The evidence is that the South African variant spreads quickly, as the Kent variant does as well. I haven't seen definitive evidence that says it spreads quicker, or indeed that it causes more harm. The bigger concern about the South African variant was whether it would reduce the immune response of the vaccine. Now, as I said yesterday, that does not mean that the vaccines are ineffective. In fact, we heard good initial news about the Oxford AstraZeneca vaccine potentially reducing transmission. Now, that would be really, really important. So at this point in time, we still need to understand where the variant is and what its characteristics are, and I don't think it would be right for me to speculate on what it might be, because that would, I think, concern lots of people, but it's why we're undertaking the investigations we are for those 3 cases where we need to understand how those people have got the South African variant here in Wales.
Thank you, Health Minister. We are seeing reports of more younger people becoming seriously ill with coronavirus, perhaps in their 40s or lower. Is there anything in the data to support this? And if so, is there any reason for this?
Well, I don't think it's the case that there is a disproportionate impact on younger people at this stage in the pandemic. What we do know is, though, that because community transmission rates have increased so rapidly through the autumn and the winter, that more people will have got coronavirus, and so that relatively small percentage will mean more people in terms of numbers. If you think about it, community transmission rates, positivity rates rather, it wasn't that long ago that 1 in 4 tests were positive. We're now down to just over 1 in 10. So you'll expect to see the numbers falling, but it's important, I think, to reflect that the greatest harm is caused to people who have pre-existing healthcare conditions, and the older you get, the more likely you are to suffer harm, particularly to go above the age of 50. That's why we prioritise the vaccine for groups over the age of 50 and people with additional healthcare needs, and of course our frontline health and care staff. That does not mean if you're under the age of 50, you can expect to be harm-free. It's why we've got a continued focus on long COVID, for example, because you know that many people have been significantly unwell but recovered. For some people, that recovery is an in and out journey, being well and relapsing. So we all need to reflect that there are healthcare risks for all of us, even if our risk of harm is reduced compared to those people who sadly are most likely to suffer the greatest amount of harm. Thank you, Steve. And I've got Rob Taylor from Wrexham.com.
Good afternoon, Health Minister. We've been sent images locally of queues outside a GP surgery of those who, by definition, are older and higher risk members of society. And in one instance, a relative told us that their 86-year-old nan was waiting outside for an hour in the cold. Others have raised concerns about the safety of individuals who have been effectively shielding for about 12 months and are worried that getting the vaccine could be a risky situation. What guidance and support has been given to vaccination centres to protect people, both in a pandemic sense and also in a weather sense?
Well, there has been guidance been issued both about the importance of social distancing while queuing and when in a vaccination centre, but also about trying to make arrangements for the time frame that people will get their vaccine. And we're encouraging people not to arrive early. It's understandable that people are keen to get their vaccine and to be protected. But if people do arrive significantly ahead of their appointment, we're much more likely to see queues. And of course, I'm concerned people are waiting for a very long time outside. So that's why following the advice that's being given, not just about attending, following from the earlier question, but also attending at the right time is really important for all of us. And I'd say to anyone who's concerned about the potential risk from going to get your vaccine, particularly if you're shielded, if you're any one of the priority groups, there's a much greater risk from getting coronavirus and not having had the protection that the vaccines provide. So I'd really encourage everyone to take up the opportunity to get protected. When it's my turn, I will certainly be going on to have my vaccine as well.
Thank you. And the French Health Minister has said the recommendation that I make to the French people is to no longer use fabric masks, as that country then follows Germany and Austria in a move towards FFP2 mask requirements. Today, Gov.Wales still says you could use a scarf or bandana as long as it tightly fits around your face. Who's setting the correct minimum standard there? Is it the Welsh Health Minister or the French Health Minister?
Well, we're following the advice that we're given. We take account of both what the World Health Organization say, but the particular advice from our Chief Medical Officer and his department. So as we update and as we consider on a regular basis as we do what that advice should be, ministers will then need to make choices about what that policy is, but it's informed by the advice we get from the Chief Medical Officer, which is exactly as I think you'd expect. That goes both for the public but also for staff as well, where the Chief Medical Officer Department takes part in UK-wide conversations to make sure we still have the right policy, the right framing of how we protect people as they go about their work, as well as each of us as members of the public to make sure we're doing the right thing in wearing a face covering where we're required to do so, where it's the right thing to help not just protect us, but in particular to protect other people. Thank you, Rob. And I've got Gareth Exendery from the Caerphilly Observer.
Thank you, Minister. Good afternoon. On the definition and distinction of elderly adult care homes, you're on record saying that all care home residents and staff will have been offered their first dose of the vaccine by the end of January. Now, whether that was a mistake or miscommunication, there are care home members of staff, residents, family members who believe that their homes, many of which do include individuals over the age of 65, would be vaccinated by now. What would you say to them now as they continue to wait?
What I'd say is that we're moving through our vaccination programme at real pace. And so you'd have seen just under 23,000 people vaccinated in the numbers that increased and reported today, more than 23,000 in the day before. And as we move from not just the first two priority groups into groups 1 to 4, you can see there's real pace being picked up there too as well. And so a number of the people that you'll describe would certainly be covered in groups 1 to 4. And after that, then certainly in groups 1 to 6 as well. So all of those people are going to expect to get a vaccine appointment in the very near future. And until then, we'll ask them to carry on doing the right thing about how they behave, the distance they have with other people, and in doing the basics as I described earlier. So I understand that many people will be anxious and nervous in waiting for a vaccine. Many people want to be earlier in the queue and not have to wait. I really do understand that quite natural human anxiety, but our NHS-led programme is not going to forget people. We will get to you, and we're going to get to you even faster than we were a few weeks ago, because the pace of our programme has increased. And I think people in Wales can take real pride in the fact that Wales is the fastest moving nation on vaccination over the last, not just the last week, but also the last 2 weeks. And that really does say something of real credit to our vaccination programme and the staff delivering it.
Thank you. We shortly move into large cohorts of people receiving vaccinations who perhaps are more mobile, and they're expected to travel to mass vaccination centres, but don't drive or can't rely on a lift from somebody else. Here in Bedwas, for example, it's an hour and 10 minutes or on 2 buses to our nearest mass vaccination centre in Newbridge. What conversations are Welsh Government having to address transport links to vaccination centres? And what's the Welsh Government's guidance on people having lifts or car sharing to vaccine centres?
Well, for example, I know that some local authorities have looked at helping to reorder bus routes around mass vaccination centres, and they've thought about where those vaccination centres should be in relation to bus routes with partners in the health service. So that work between local authorities and health boards, it's been such a feature throughout this pandemic, is absolutely a part of what's making the vaccination programme a real success. It's also, of course, the case that it's not just mass vaccination centres. In the statement I gave to the Senedd yesterday, I was able to confirm we now have more than 400 GP-led locations delivering the vaccine as well. So there's actually a wide range of different centres available to help people have their vaccine, as well as the mobile units that are going around not just to care homes, but to other housebound individuals who can't get out of their home. Now, the advice we've given, you may well have seen pictures on social media of people transporting relatives, and pleased to see that in almost all of the pictures I've seen, people are wearing face coverings as well. We still ask people to think about the advice we've given about reducing contact with people and about taking all necessary precautions in getting to and from centres. So if you're concerned about where your vaccination is being delivered, you should reflect on where that centre is, how you'll get there, and how to manage your transport there, and equally, how to reduce your risk if you have got people who are going to help to take you there. And of course, travel to a vaccination centre, whether it's one of the GP-led centres or one of the mass vaccination centres, would be essential travel within the rules as well. So people need not worry about either taking people there or travelling to get their vaccine as well. Thank you, Gareth. We've now got Tom Magner from Carers World Live.
Thank you, Health Minister. Your colleague, the First Minister, announced almost 2 weeks ago now that your government would add unpaid carers into the main wording of Vaccine Priority Band 6. That's naturally been welcomed by our viewers. Updating, of course, must take a little time. But there's disappointment setting in because even as late as yesterday, Public Health Wales were republishing the priority list without this important extra wording. And also this morning, we've heard of GPs refusing to register unpaid carers, saying they aren't full-time unpaid carers. And here they clearly got it wrong because the latest carers' rights did away with minimum hours to qualify for an assessment. I'm sure that you will find these developments disappointing and concerning. So what steps have you taken and do you plan to take to make sure that everyone's singing from the same Welsh Government song sheet and as a matter of urgency?
Well, there's a vaccination programme board today that I attend regularly with other stakeholders. So we do talk about these issues regularly. And I think from the government's point of view, we've been very, very clear about unpaid carers being in Group 6. And I think you've been very helpful in broadcasting that to our viewers and listeners, as indeed have other carers organisations. And the conversations have started with carers organisations about how to properly identify people as unpaid carers to make sure that they're going to get their vaccine within the right priority group. And those conversations aren't complete because, as you will know, the circumstances for different carers are different, and not everyone is on a specific list at present. Some are, but we're going beyond simply people who are entitled to a specific benefit because that doesn't properly cover all those people who are unpaid carers. And it's then a matter for me to make sure that we are updating the public-facing information, and I'll make sure that's part of the conversation around Vaccine Programme Board when I meet with my officials before and after it as well.
Thank you for that. In terms of identification, perhaps I could explore this a little further. I imagine that some will suggest that you should start with the JCVI definition of an unpaid carer in their advice, which, for those not familiar with it, says that those people who are in receipt of a carer's allowance or are the main carer of an elderly or disabled person whose welfare may be at risk if the carer falls ill. So against this background, my question is, how do you plan to identify those unpaid carers who are either having issues with overlapping state benefits or who are under the age of 65 that may not be receiving carers allowance because they're working and earning over the £128 a week earnings limit to be able to qualify for carers allowance? How will you deal with these people? Because they're probably in the majority.
Well, that's exactly why we're having a conversation with carers organisations, because you can essentially take two approaches. You can take the approach of, if you meet this strict criteria, then you get the vaccine in Group 6, and if you don't meet that, then you don't. Now, we know that that would mean that there'd be a significant number of unpaid carers who would not get their vaccine at the right time, and I think that would cause a significant amount of unhappiness and injustice. That's why we're talking with carers organisations about how to have the most sensible approach possible to identify people. And it's then about how successfully we're able to do that, and crucially, to make sure that some people don't take advantage of the position by claiming they're an unpaid carer when they're not. Now, that's difficult because a lot of this is about people identifying themselves as carers. So that's why we're having this conversation with carers organisations, many of whom will have contact with unpaid carers and be able to help, I think, to identify people who are undertaking unpaid carer roles. I've discussed with you in many of these press conferences the fact that I undertake a bit of care for my mum and that I take her shopping. She can't go out. But I wouldn't say that that put me into the unpaid carer category because I visit her home once a week to deliver her food shopping. But, you know, we need to have a conversation with carers organisations to get to a sensible point where we can understand who's coming through, what the numbers are, and then crucially, how they can then be invited to come to their vaccination appointment. What I don't want, we have tens of thousands of people ringing up to try to get an appointment in a way that could hold up the vaccination progress and then reduce the speed with which we're working to give people the protection that they're looking for. So it's a sensible conversation. It's a very grown-up one. It has to be very practical then as well, Tom. And when we're in a position to finalise that conversation, we'll make sure there is a proper public announcement. It will be covered and updated on the Welsh Government website as well, so people can find that information and hopefully then get assurance that they'll get their vaccine in good time.
Thank you.
Thank you very much, Tom, and thank you, everyone. I look forward to seeing you again in the near future, no doubt.